All right, let's just dive right into this explainer. We're unpacking a massive, literally life or death mystery hidden deep in our healthcare data. We're going to look at why a country with some of the absolute best medical innovation on the planet is, quite literally, losing its citizens at a staggering rate compared to our global peers. Between 1999 and 2022, an astonishing 12.6 million excess deaths occurred right here in the United States. Think about that for a second. That is 12.6 million people who died who statistically would still be alive today if they lived in a comparable high-income nation. To really put that into perspective, it's like the entire population of Pennsylvania or Illinois just vanishing over 2 decades. Absolutely wild. So it begs the question, right? What exactly is driving this massive mortality gap? I mean, we have MRI machines everywhere, breakthrough cancer treatments, literally some of the most advanced medical tech on Earth. So if it's not a lack of scientific capability, what is fundamentally broken in our environment, causing Americans to die so much earlier than their peers? To solve this, we're relying heavily on a landmark May 2026 study published in JAMA Network Open by Bohr and colleagues. This isn't just some rough estimate. They pulled together a massive, robust data set spanning over 2 decades and 17 peer nations. They performed what they brilliantly call a population autopsy. Basically, they systematically broke down the exact causes of these missing American lives to help us figure out the structural drivers of the crisis. Now, before we get into the specific culprits, let's quickly define our core metric here. When we say excess deaths, we're talking about the absolute difference between the observed U.S. deaths and the deaths we'd expect if our mortality rate simply matched 17 other high-income countries. We're talking about places like Canada, Japan, Switzerland, the UK. If our living conditions match theirs, these are the lives that, statistically speaking, shouldn't have been lost. And the contrast here is just fascinating. The researchers highlight that the U.S. has very similar access to advanced medical tech and treatments as those 17 peer nations. Yet, despite having the exact same cutting-edge medicine, our overall death rate by the end of the study in 2022 was nearly 40% higher. So our healthcare system is great at treating complex diseases once they happen, but something upstream is clearly failing us. Part 1. The leading culprits. The 2022 autopsy results show us exactly what's going on. Over half, 52% of these excess deaths were driven by circulatory issues, like heart disease and metabolic conditions like diabetes. Then another 20% were driven by mental and nervous system disorders, which heavily impact older populations, things like Alzheimer's. And a growing 14% were driven by drugs, alcohol, and suicide. Let's zero in on that biggest chunk for a second, heart and metabolic health. Between 1999 and 2009, the U.S. was actually making decent progress here. But the data shows that after 2009, our progress just completely stalled out. While those 17 peer nations kept improving their cardiovascular health, our mortality rates plateaued, heavily impacting adults aged 45 and older. We basically just stopped getting healthier while the rest of the developed world kept right on moving forward. Part 2. The youth crisis. To really grasp the severity of this, we have to look at a metric called years of life lost. We use this because, well, losing a 25-year-old leaves a vastly different statistical and societal crater than losing an 85-year-old, right? Years of life lost heavily weights deaths at younger ages, which shows us the total potential future time literally robbed from the population. And when you view the data through that specific lens, you hit this genuinely horrifying statistic. In 2022, the U.S. death rate from drug poisonings was an unthinkable 7.48 times higher than in other high-income countries. We aren't just a little bit worse in this category, we are an extreme outlier on the global stage. The researchers categorized these as deaths of despair, so drugs, alcohol, and suicide. The introduction of fentanyl into the drug supply after 2013 caused these numbers to absolutely skyrocket. For Americans under 45, these 3 causes alone account for the vast majority of our excess mortality compared to our peers. And while they make up 14% of the total excess deaths, they account for a massive 22% of the total years of life lost. That's robbing the country of millions of future years of life and productivity. Part 3. The pandemic effect. Now, we obviously have to talk about COVID-19. The virus directly caused roughly a fifth of our excess deaths during the pandemic's peak in 2020 and 2021. Because the U.S. struggled more with the virus than a lot of our peer nations, COVID-19 significantly exacerbated our already existing baseline mortality disadvantage. But what the JAMA study really highlighted here was a sort of fatal domino effect. The pandemic didn't just kill people with the virus itself. The massive disruptions in medical care and the fraying of social safety nets caused huge spikes in our pre-existing vulnerabilities. We saw massive surges in deaths from drug overdoses, heart failure, and metabolic conditions during those exact same years. The system was stressed to the max, and the cracks we already had just gave way entirely.
Part 4, Closing the Gap with Policy.
The Burris et al. Study explicitly points out a vital, honestly empowering truth. This gap, it's not some unsolvable biological mystery. It's a policy gap. The excess deaths we're seeing are considered avoidable, simply because the policy interventions required to stop them already exist, and they're currently being used every day by other high-income countries. By just looking at the roadmap provided by our 17 peer nations, the solutions become super clear. The researchers highlight that expanding comprehensive health coverage, strengthening economic safety nets, tightening regulations on opioid prescribing, and improving our food environment to combat obesity could quite literally save millions of lives. For example, expanding health coverage ensures early intervention for those deadly metabolic conditions, while stronger economic safety nets help prevent the despair driving the youth overdose crisis. So, that 1.38 times higher mortality rate, it isn't a failure of our doctors. It's a failure to implement these preventative health and social policies. And, the researchers note that we don't even have to look across the ocean to prove this works. We see it right here within our own borders. U.S. regions and states with less protective safety nets and weaker health coverage policies currently bear the absolute brunt of these excess deaths. The policies dictating our environment, our access to care, and our social support structures are the true drivers of life expectancy. So, the ultimate takeaway for you from this explainer is this. The population autopsy is complete. The data clearly shows us exactly why we're losing millions of Americans to early deaths, and it points directly to the health and social policies that can fix it. The data gives us the cure, but the provocative question we have to leave you with is, are we actually willing to write the prescription?